Can lipid-lowering drugs interact with other medications? Have you ever wondered if the medications you take for lowering lipids could affect other drugs? This is an important question, especially for those managing hyperlipidemia and cholesterol levels. Let's break down how these interactions can happen and what you should know. Lipid-lowering drugs, such as statins and fibrates, are commonly prescribed to help reduce cholesterol levels and lower the risk of heart disease. Statins work by blocking an enzyme in the liver that is responsible for cholesterol production. However, many statins are processed by liver enzymes, particularly cytochrome P450 enzymes, which can lead to interactions with other medications. One way these interactions occur is through enzyme inhibition or induction. Some medications can inhibit the activity of cytochrome P450 enzymes, leading to higher levels of statins in the bloodstream. This can increase the risk of side effects like muscle pain or damage. Conversely, other medications may induce these enzymes, which can lower the effectiveness of statins. Another mechanism involves transporter interference. For example, Cyclosporine can inhibit liver transport proteins that help statins enter liver cells, affecting their action and safety. Additionally, combining drugs that have similar side effects can amplify those effects, leading to increased risks for patients. Let's look at some specific examples. Cyclosporine is known to increase statin levels, which raises the risk of muscle damage. Gemfibrozil, a fibrate, also interacts with statins by inhibiting enzymes that process them, leading to a higher risk of myopathy. Calcium channel blockers like amlodipine can modestly raise levels of simvastatin, so it's important to limit the dose of simvastatin when combined with amlodipine. However, amlodipine does not significantly interact with atorvastatin. Other medications, including colchicine and certain immunosuppressants, can also raise statin levels or increase side effects. Alcohol consumption should be minimized while taking statins due to its effects on the liver and cholesterol metabolism. For patients on lipid-lowering therapy, it is essential to regularly review all medications with a healthcare provider. This helps identify potential interactions and manage them effectively. Sometimes, dose adjustments or switching to statins that are less affected by liver enzymes, like pravastatin or rosuvastatin, may be necessary. Monitoring for muscle symptoms and conducting liver function tests can help catch any adverse effects early. In summary, lipid-lowering drugs can interact with other medications primarily through effects on liver enzymes and transport proteins. Being aware of these interactions is vital for safely managing hyperlipidemia and cholesterol levels. Always consult with your healthcare provider about all medications you are taking to ensure safe and effective treatment.